The healthcare system was created to help you. But who really executes that intention? Here is an insider's view on how things really work.
Welcome to the Ultra Healthy Now podcast, where your journey to feeling younger, sexier, and more energized begins. Dr. Nicole Srednicki, who specializes in high-performance health, will dive into practical, actionable tips and strategies that can transform your physical, mental, and emotional well-being. Join us as we uncover the secrets to living a healthier, happier life, mind, body, and spirit. Because true health, beauty, and happiness start on the inside.
Today, we're exploring a question that affects everyone but is rarely discussed honestly. Is our healthcare system designed with you in mind, or are other interests steering the ship? Hello, and welcome to Ultra Healthy Now, the weekly podcast where we dive into the journey of maximizing your health potential. I'm your host, Dr. Nicole Srednicki, founder of Ultra Healthy Human, where we specialize in high-performance health for high-performance people. The healthcare system was created to help you, but who really executes that intention? Pharma, insurance companies, or healthcare providers? Their interests may not always align with yours. Here is an insider's view on how things really work. Last week, I saw my oldest patient, Albert, an 84-year-old who's been with me for years, and he's also become a close friend. He's one of those people who lights up a room. He's always positive and full of life. Over time, Albert has made incredible strides with me, shedding over 20 pounds with the 21-day ultra healthy detox and addressing early diagnoses that we caught in time. During our recent follow-up, everything looked great. Then a couple days later, I got a call from his daughter. He was in the hospital. Confused, I asked what happened. She said he went to the pharmacy to pick up a prescription, and the pharmacist recommended he get 5 vaccines. He agreed, innocently being a compliant patient, thinking these recommendations were in his best interest. The next morning, he was disoriented and dizzy, eventually falling out of bed and not being able to stand up, ending him in the emergency department. The emergency room checked his vital signs and labs. Blood pressure, heart rate were fine. Oxygen levels were fine. Respiratory rate and temperature all fine. Based on one of the lab results, they made a diagnosis of heart failure and gave him a water pill to get rid of the water from his body. When I got to the emergency room, I looked at his monitor and his blood pressure was dangerously low, 84/47 and then 76/44. He felt horrible and could barely stay conscious. During all of this, I asked his daughter if the staff was aware of this blood pressure. And she said, no one's checked on him in a while. She said, I didn't even know it was low because nothing's beeping. I urgently got the staff involved. Eventually, after the chaos, he was stabilized. He then was taken from the emergency department to be admitted into the hospital to stay overnight. The following day, he was discharged from the hospital. So this sounds like a normal thing that can happen if your friend or family member's in the hospital, right? Now let's break down this, quote, normal sounding hospital visit from an insider's perspective. Problem 1, vaccines for the elderly. Should an 84-year-old get a vaccine? Most people would say yes, because they're older, they don't have a lot of resistance to fight infections, and it seems reasonable to consider a vaccine to help. So the philosophy of vaccines may be okay, but have vaccines been studied in 84-year-old people? The answer is no. Most clinical trial inclusion criteria is aged 18 to 80 in adults. Philosophically, it may benefit, but is it proven to be safe? No. Therefore, an informed decision has to be made. The patient should be made aware of these details. Remember, this could be your parent, your grandparent innocently walking into the pharmacy. Problem 2, who should recommend vaccines? Who administers the vaccines? Unlike a doctor who knows your medical history, a pharmacist is operating under general protocols, sometimes with quotas to meet. And while they may act in good faith, they don't have the complete picture. Have they been trained to ask the appropriate questions or just check some boxes? Would you trust somebody with only half of the story to make crucial decisions about your health? For you entrepreneurs out there, if you're looking to buy a business and the seller only shows you half of the balance sheet, are you going to trust that everything's fine? No, you're going to do your due diligence. Problem 3. Are you ready for something for free? If you can bring me any study that studied the effects of 5 vaccines given at the same time to an elderly patient, you can be my patient for life free of charge. The problem is no one knows what can happen if 5 vaccines are administered on a single day to an 84-year-old at the pharmacy. There simply isn't research supporting this. My patient, like most, trusted the system. But the reality is that he unknowingly entered an experiment with outcomes that no one could predict. It used to be that a doctor had to write an order to get a vaccine. Why is this not required anymore? Whose best interests are we looking out for? Pharma, pharmacy businesses, or the patient? Among these 5 vaccines, one of them was the COVID vaccine. I'm not necessarily against vaccines, but especially a new vaccine. I am all about informed decision-making, critical thinking, and patient advocacy. Naturally, I was flustered with what had transpired with Albert. So I called a pharmacy friend of mine. He confirmed that as a pharmacist, they are heavily encouraged to push vaccines on customers and actually have quotas to meet for certain vaccines. So the pharmacist that had administered the vaccines didn't know the patient. He obviously wasn't using critical thinking skills. Maybe he was fearful that he wasn't meeting his quotas. So he didn't put the patient's best interests as priority. Whatever the case, there are major flaws in the system. Now let's talk about the emergency room. Problem 1, emergency room assumptions. When I arrived to the emergency department, I saw the drop in Albert's blood pressure. This was after they had given him medication in accordance to what they thought was a heart failure exacerbation. I carried out my own physical exam because his symptoms didn't align with heart failure, and I suspected the vaccines could be at play. The emergency department dismissed my input. So then I called my colleague, a heart failure specialist who also knew this patient. I relayed what was happening in the midst of the chaos. I told him about my physical exam findings. We both agreed that this was the wrong diagnosis, with subsequent wrong treatment, resulting in critically low blood pressure. Of note, emergency departments are notorious for addressing the first abnormality that comes up and assumes that's the patient's condition. Have you ever been quick to jump to a conclusion without looking at the whole picture? Problem 2, alarming issues. When there's a significant drop in blood pressure, the monitor alarm should go off to alert the staff members. Do you know why Albert's monitor wasn't alarming? Because it was set to silent. So no notifications to alert staff that his blood pressure was dropping. I asked his daughter if anyone has been in to see him. She confirmed that no one was in for a while. No one had seen his blood pressure dropping. This could lead to cardiac arrest. Think about it. How often are these silent alarms going unnoticed in hospitals? It's like watching your business hit red flags on the metrics, but your analytics tools are turned to mute. By the time you're aware, the damage is already done. His daughter said, "What would have happened if you weren't here? The alarms weren't going off, so we didn't think anything was wrong, and no one has checked on him recently." At this point, I alerted the nurse and asked for a call from the hospitalist. I also got my colleague, the heart failure cardiologist, on the phone, and together we spoke with the hospitalist about Albert's plan of care. Changes were initiated. The next day, a cardiologist who works in the hospital evaluated the patient and agreed with our impression that the patient was not in heart failure. He should have not received the medication that was given in the emergency department, and it was actually due to receiving multiple vaccines on the same day. Luckily, my patient's blood pressure had improved, and he was able to be discharged and go home to rest later that afternoon. So let's recap. When I told you the story, it seemed normal. However, it was nowhere near normal. There were 3 problems outside of the hospital that were unrecognized. There were 2 problems in the hospital that resulted in wrong decisions being made. All of this put the patient's life at risk. But let me also tell you a few other issues that made my skin crawl. Number 1, I watched a nursing assistant walk out of a patient's room with her gloves on, walk right into my patient's room with the gloves still on, and went up to the patient to start adjusting something. I intervened, of course, but this is a perfect example of how infections are spread. Number 2, I asked the patient, why is there a pill sitting on your tray? And his family member said they noticed it on the floor, and when they told the hospital staff member, they put on gloves, picked up the pill off the floor, and set it on his tray. Not only is this unsanitary, but we didn't even know if it was his medication. I put the pill in the garbage and then cleaned off his tray. If you'd like a list of hospital tips to keep you safe, send us a message in the contact section at ultrahealthyhuman.com with the word hospital. It probably won't save your life, but it may be helpful to give you some awareness. Now let's talk healthcare advocacy. So, is the system safe? It was designed with good intentions, yet flaws in execution put patients at risk. This is where a healthcare advocate becomes invaluable. Let me ask you a question. Would you go to court without a lawyer? The lawyers are called advocates for a reason. They advocate for you, but they also understand the law. A health advocate understands the system's in and outs, spots potential pitfalls, and can act swiftly. Why, then, would you navigate healthcare alone? So, who should be your advocate? Someone who is qualified in health and medicine, like a primary care provider, someone who knows you well, someone who goes above and beyond, who cares for you. For example, when my patient's daughter called, I went to the ER myself. I've had other cases where I've gotten on the phone with the healthcare providers. With the collaboration with the hospital staff, my cardiologist, pharmacist, and of course the patient's family, we were able to set things right. Without this advocacy, he would have remained a number in the system without personalized care. I worked in the hospital for years, so I'm aware of policies and protocols. I've seen these errors happen and things didn't end well. I'm also sharing this story because this isn't the first time I've stepped in as a health advocate and intervened before things went terribly wrong. So let's recap the key problems. An unstudied vaccination approach that could have cost Albert his life. 2, a lack of coordination between those administering the vaccines and those who understand the patient's medical history. 3, incorrect diagnosis in the emergency department leading to potentially dangerous treatment. 4, lack of patient monitoring and infection control. So, what are the take-home messages here? We need to ensure that the right treatment is given to the patient and don't settle for blanket solutions, like giving multiple vaccines with no safety research. Timing matters. Know when vaccines or treatments are necessary and when they aren't. Seek the correct diagnosis before starting any treatment. This patient received an incorrect diagnosis and treatment that could have resulted in far worse outcomes. Find an advocate, a knowledgeable and proactive healthcare partner who will identify issues before they escalate. And look at the team. I was able to champion for Albert when he was unable to champion for himself. I called in the team, the emergency department doctor, the nurses, his daughter, the pharmacist, his cardiologist, all to collaborate. My final thought is, if this had ended differently, it would have been easy to attribute it to his age. But with the right advocate, we were able to prevent the worst. Don't leave your health to chance. Remember, this could have been your parent or grandparent. Thank you for joining me for another episode of Ultra Healthy Now. If today's episode sparked your interest in achieving your maximum health potential, or you have questions about health advocacy or want that tip sheet, I invite you to contact us or visit us at ultrahealthynow.com. Explore our specialty formulated supplements, ask questions, suggest topics for the Ultra Healthy Now podcast, or schedule a consultation. Join us at Ultra Healthy Human, where your health, beauty, and happiness begin from the inside. Visit ultrahealthynow.com to start your transformation today. Thank you.
Thank you for tuning in to the Ultra Healthy Now podcast with Dr. Nicole Srednicki. To discover more, visit ultrahealthynow.com and jumpstart your wellness journey with our 21-day detox program, a total body reset, more energy, better focus, and weight reduction. Our carefully formulated, high-quality supplements will aid in a new level of wellness. Don't wait. Unleash the Ultra Healthy Human within you. At Ultra Healthy Human, Eastern and Western modalities are combined with cutting-edge technology to guide personalized health programs to help you tap into the limitless potential of your mind and body. Because true health, beauty, and happiness start from within. Remember to subscribe, like, and share this episode wherever you listen to podcasts.
And before we sign off, I want to make it crystal clear that the information presented here is for informational and entertainment purposes only. This episode should not be considered a substitute for professional medical advice, diagnosis, or treatment. And while we strive to provide accurate and up-to-date information, the content discussed in this podcast is based on general knowledge and research available at the time of recording. Medical knowledge and guidelines can evolve, and what we discussed may not always reflect the most current research or recommendations. If you have specific health concerns or questions, we strongly encourage you to consult with a qualified healthcare professional or a medical specialist who can provide personalized advice tailored to your unique circumstances. Every individual's health situation is unique, and what works for one person may not be suitable for another.
This podcast is a presentation of the Rich Dad Media Network.